Speaker, and with your permission, I would like to make a statement about the introduction of public health measures at the border in response to coronavirus. This is another cross-government measure in our continued collective fight against the virus to save lives and protect the British public by preventing a second wave of this disease. Because our priority has always been to protect people's health and to keep those in the UK safe from the virus, and introducing this measure now will play an important role in our fight against coronavirus. The tragic events of recent months have shown that in a world of serious threats to the UK and to global stability, pandemics have no boundaries. Throughout this national endeavour, the introduction of public health measures has been to protect the public, keep the virus under control, and now to protect our hard-won progress as we move in the right direction. The scientific advice has been consistent and clear, and it is thanks to the collective determination and the resolve of the British public we are past the peak, but we are now more vulnerable to infections being brought in from abroad. Some have suggested that public health measures at the border should have been introduced when the virus was at its peak. However, at that time, the scientific advice was clear that such measures would have made little difference when domestic transmission was widespread. But now, the transmission rate in the United Kingdom continues to decline, and international travel is likely to resume from its record low. Therefore, the scientific advice is that imported cases of the virus pose a more significant threat to our national effort and our recovery. Travellers from overseas could become a high proportion of the overall number of infections in the UK and therefore increase the spread of the disease. The government has therefore taken a proportionate and time-limited approach to protect the health of the British public. Madam Deputy Speaker, I will recap and recall to the House the key points of the public health measures the government is putting in place from the 8th of June. These temporary requirements are set out in the full health protection regulations laid today, and these will apply across England, with devolved administrations laying their own regulations to set out their enforcement approaches. To limit the spread of infection, arrivals must self-isolate for 14 days. This is the incubation period of coronavirus, and this follows expert medical advice and is in line with the NHS Test and Trace Service self-isolation period for anyone who has been in contact with the disease. Working with key industries, the government has deliberately included a limited number of exemptions to the self-isolation rules to allow essential services and supply chains to continue, keeping food on our tables and getting vital medical and PPE to the front line. The responsibility for sector-specific exemptions sits with relevant government departments. Arrivals to the UK will be required to fill in a contact locator form, including details as to where they will isolate and how they can be contacted. This form will be found on gov.uk, and a government-led working group with the industry has developed a process for carriers to inform travellers on the information they need to provide in order to travel to the UK. The form must be completed in advance of travel to provide details of the journey, and Border Force will be at the front line of enforcing this requirement. Passengers will require a receipt, either printed or on their phone electronically, to prove that they have completed the form. And Border Force will undertake spot checks at the border and may refuse entry to non-resident nationals who refuse to comply. They will have the power to impose a £100 fixed penalty notice to those who do not comply. And our fantastic frontline Border Force officers are world-class and consistently working to keep our borders safe and secure. The data collected will be used by Public Health England, who will undertake checks and ensure people understand and are following the rules. And if Public Health England have reason to believe someone is not following the law as they should be, they will inform the police. We trust the British people and our visitors to play their part in acting responsibly and following the rules to control the spread of coronavirus. But, Madam Deputy Speaker, we will not allow a reckless minority to put our domestic recovery at risk, so there will be penalties and enforcement for those who break them. A breach of self-isolation could result in a £1,000 fixed penalty notice in England or potential prosecution. And this programme will work alongside Test and Trace to help us further minimise the public health threat of coronavirus. Madam Deputy Speaker, Secretaries of State from the Cabinet Office, Transport, Business and Health have worked across government, the devolved administrations, with science and industry to develop the policy carefully for this public health action. In line with all government COVID-19 measures, and as I announced on the 22nd of May, the measures will be kept under regular review to ensure they remain proportionate and necessary. I can inform the House that the first review will take place in the week commencing the 28th of June, and they will be assessed on an ongoing basis thereafter, together with all other measures to fight this disease. We will publish in due course more information on the criteria that must be satisfied to lift these health measures, but I can update the House on some factors that will be considered. And these include the rate of infection and transmission internationally and the credibility of reporting, the measures that international partners have put in place, levels of imported cases in other countries and where they are more relaxed border measures, and the degree to which antibody and other methods of testing prove effective in minimising health risk. Country-specific reports will be provided to allow us to monitor global progress. But we will only consider reviewing these measures when the evidence shows that it is safe to do so, because public health will always come first. And as we have considered for all our cross-government COVID-19 measures, we will take into account the impact on economy and the industry. The aviation and travel industry is home to some of Britain's most successful businesses and supports thousands of jobs. Across government, we understand how tough the public health measures to prevent a second wave of coronavirus are for this sector. The industry has a proud record of making safety of its passengers and staff its #1 priority. It also has a record of dynamism and innovation. Engagement with the industry is crucial, and we are asking them to work with us on these measures. We are liaising with bodies such as the International Civil Aviation Organization on this and on other COVID-19 related issues, and we will continue to work closely with companies and carriers. And that is why, with my right honourable friend, the Transport Secretary, we will tomorrow host a roundtable to work across the travel sector and the broader business sector as well, on how we can innovate and move together, but also form a long-term plan for the industry. The government and industry share the same aim, to get Britain and our economy moving again in a way in which is safe and also practical for everyone. Madam Deputy Speaker, our priority has always been the safety of our people. This has driven our evidence-led cross-government approach to this whole crisis. The Foreign Office will continue to they currently advise against all but essential travel abroad, or no travel at all to a country where the risk of COVID-19 remains unacceptably high. There has been engagement with embassies representing countries from around the world to explain our approach. And taking this public health action, alongside our measures, including test and trace and continued social distancing, in the long run, we will ensure that we can have greater freedom in the longer term. And of course, Madam Deputy Speaker, that includes international travel corridors, a subject that has already this afternoon been discussed in the House. Currently, there should only be essential travel, but across government and with the sector, we will continue to explore all options for future safe travel. And any international approaches will be bilateral and agreed with other countries concerned. And of course, we will need to ensure that those countries are deemed to be safe. We are not alone in our fight against this disease or in the measures we have taken to stop it. Madam Deputy Speaker, these measures are backed by science and supported by the public and are essential to save lives. We know that they will present difficulties for the tourism industry, but that is why we have an unprecedented package of support, the most comprehensive in the world, for employees and for business. But we will all suffer in the long run if we get this wrong. And that is why it is crucial that we introduce these measures now. Let us not throw away our hard-won progress in tackling this virus. And first and foremost, we owe it to the thousands of people who have died. And we owe it also to the millions of people across the whole of the United Kingdom whose sacrifices over the previous months in following social distancing have together helped us to bring this virus under control. I commend this statement to the House.
Shadow Home Secretary Nick Thomas-Symonds.
Thank you, Madam Deputy Speaker, and I thank the Home Secretary for her statement and advance sight of it. We've been calling for sensible screening measures at the border for months, and we will of course study the detail of what's been announced. It is vital the UK has a plan for minimising the risk of infections coming into the country. But the Home Secretary must also realise there are fundamental questions she needs to answer. Why these particular measures and why now? From 1st of January to 23rd of March, when the lockdown was imposed, only 273 people were formally quarantined from 4 flights, 3 from Wuhan, 1 from Tokyo, when over 18 million people entered the country by air. Now, the Home Secretary just said in her statement this was because domestic transmission was widespread. But this is what the government's own chief scientific advisor said, and I quote, "A lot of the cases in the UK didn't come from China and didn't come from the places you might have expected. They actually came from European imports and the high level of travel into the UK around that time." And ministers saw on their television screens what was happening in Italy and what was happening in Spain. On the 30th of April, I wrote to the Home Secretary to ask her to publish in full the scientific advice that her decisions on measures at the border at that time were based on, so we could learn the lessons going forward. She hasn't even replied to my letter, and not making all that information public is a mistake. Unfortunately, like too much of the Home Office handling of this crisis, the management of arrivals to the United Kingdom has lacked urgency and coherence. As long ago as the 10th of May, the Prime Minister gave notice of these quarantining measures. Why has the government wasted precious weeks talking about possible border restrictions rather than taking effective actions? If these measures are necessary from the 8th of June, why have they not been necessary in recent weeks, or from when they were first announced by the Home Secretary herself on the 22nd of May? And can the Home Secretary give me her assurance that these measures from Monday next week have been recommended and approved by SAGE? I do join her in her praise of what those at Border Force have done, but can she give me a further assurance the Border Force on the front line will have the resources and all the protection that they need? Madam Deputy Speaker, the government's confusion over arrivals and quarantine has widespread implications for the UK economy, particularly aviation, hospitality and tourism and related supply chains. Huge numbers of jobs are at risk, yet the crucial package of support for these industries that we on these benches have argued for has yet to materialise. In her statement, the Home Secretary mentioned a roundtable with the Transport Secretary tomorrow with businesses. But the government should already have done that. They should be presenting these steps today as part of an all-encompassing approach to travel to the aviation sector backed up by the published scientific evidence. And this is necessary, Madam Deputy Speaker, because there has to be reassurance that quarantine has a genuine public health benefit now that, according to the government, it did not have in past months. And that these measures are not just a 3-week fudge to try to spare the government embarrassment for failing to grip this issue at the right time. And given, Madam Deputy Speaker, that there is no vaccine at the moment, that Test, Track and Isolate isn't fully up and running as the government promised that it would be, I ask that the Home Secretary makes a commitment that she'll report back to the House before the end of the initial 3-week window on that first review that she mentioned in her statement, outline her proposed exit strategy from these measures, outline her plans for any travel corridors, and can the Home Secretary pass on the message to the government of how urgent it is that that comprehensive package to support jobs is brought forward as soon as possible?
Home Secretary.
Madam Deputy Speaker, well, I thank the Right Honourable Gentleman for his comments, his questions and his remarks. And first of all, Madam Deputy Speaker, I think all members of the House will recognise that through the difficulties that the entire country has experienced through coronavirus and throughout this outbreak in particular, across government, led by the scientific advice, but also led by my right honourable friend, the Health Secretary, throughout government we have had a comprehensive response. Throughout the outbreak we have brought in the right measures at the right time. time based on scientific advice. That is dated back to January, as far back as January, throughout February and going into March as well. And during that contained phase, the government had, at the borders in particular, an enhanced monitoring policy and approach to identify symptomatic travellers from high-risk areas in the early stages, and importantly, at that time, to safely triage them through the system. And this was applied to those returning from Wuhan on the 22nd of January, and that approach was broadened, if the Honourable Gentleman would let me finish, please, and would listen to the facts that I'm providing him with, broadened to the whole, they are facts and they're very specific dates, returning from Wuhan on the 22nd of January, and that approach was broadened in conjunction with the Department of Transport for the whole of China on the 25th of January, and then Japan on the 8th of February, Iran on the 25th of February, Northern Italy on the 4th of March, and then the whole of Italy on the 5th of March. And once when there was significant transmission within the UK, border restrictions would have been very marginal in their impact on the epidemic within the UK. Ministers at the time had articulated that across government in the comprehensive way in which this is a cross-government pandemic and all government departments work together. And at that point, it was recognised that they would have contributed a tiny proportion of the number of new infections in the UK. Now that domestic transmission within the UK is coming under control, it is the right time to prepare for these new measures at the border. But the Right Honourable Gentleman did also ask, I think for the benefit of the House, in terms of the health measures that were brought in the very early stages, they were brought in through the General Aircraft Declaration System, through Aviation, so it is through my right honourable friend, the Transport Secretary's Department, in conjunction with Border Force. And when that process concluded, it had covered 13 UK airports, 15 territories, 24 airlines, and 1,116 flights were monitored with a 98% compliance rate on the General Aircraft Declaration. And the purpose of those declarations are, of course, to provide the details of any illnesses on board and therefore inform public health risk assessments so that the appropriate action could therefore be taken with passengers at that particular time. Now, the Right Honourable Gentleman has also asked and touched on a number of other factors, including PPE for border staff. Border Force have been exceptional throughout this crisis, Madam Deputy Speaker, and I think it is worth paying tribute to them and the way in which they have worked in keeping our borders safe and secure. They do have, and throughout this, following all the public health guidance from PH England, adequate PPE protection, and that remains and will continue. And finally, Madam Deputy Speaker, in response to the Right Honourable Gentleman, he rightly asked about a comprehensive approach for the sector, for travel, tourism, for aviation, the world-class industries that we have in the United Kingdom, and rightly so. I've worked with many of those sectors in my previous career as well. A comprehensive approach is being taken. He asked as to why we're only meeting with them now. That is not the case at all. The Department of Transport, I myself have also been in touch with many representatives from the industry as well. We work across governments, and I know the Honourable Gentleman is nodding his head on that point as well. In response to the Transport Secretary, he would rightly expect a comprehensive approach. That comprehensive approach will be coming forward again on the floor of this House, not just by myself, but my other colleagues, my right honourable friends as well across government who lead those departments, and the collective response to this particular issue.
Thank you very much, Madam Deputy Speaker. Quarantine will have an impact upon businesses who rely heavily on the hospitality sector, like ceramics in Stoke-on-Trent. Churchill, China and Steel Light have spoken to me on that point. So can my right honourable friend explain and reassure ceramic manufacturers that quarantine will not hinder them as they try to reboot the local economy?
Well, my honourable friend is absolutely right in terms of the fantastic ceramics industry in Stoke-on-Trent, and he, of course, is a great advocate for them as well. There are some very important points just to make on this, Madam Deputy Speaker, and I reiterate again, these are public health measures designed to protect the British public for imported cases of coronavirus. But, of course, we are global Britain. Our borders are not shut. Let me just emphasise that point to the House. We are a global Britain when it comes to goods in particular and exports, either coming in, goods going out of the country as well. All of that will continue, and businesses, of course, continue to be at the forefront of being Global Britain, and that, of course, will continue for the ceramics industry.
Joanna Cherry.
Thank you, Madam Deputy Speaker, and may I thank the Home Secretary for advance sight of her statement, and like her, pay tribute to our border force and other key workers. Madam Deputy Speaker, the Scottish National Party have been calling on the UK Government to introduce public health measures at UK borders for some months now. The Centre for Evidence-Based Medicine at the University of Oxford have said that the effectiveness of quarantine during a viral outbreak relies on the timing and accuracy of the quarantine period, as well as the ability of individuals and healthcare providers to follow quarantine procedures. And I fear that the Home Secretary's statement does not fully address these matters. There has been widespread concern that the UK has been out of step with most other countries who introduced public health measures at their borders far earlier in the pandemic. The best way for her to address the failure to introduce any measures to date, and also the effectiveness of the measures she now proposes, is to publish the evidence and the advice upon which she has relied. Now, the matter was discussed at the SAGE meeting on 7th May, but their advice has yet to be published. Will she undertake to publish that advice from the meeting of 7th May today? And can she tell us what advice have SAGE given about the widely reported aspects in which it is suggested the government intends to water down the quarantine proposals? Do SAGE think these quarantine measures will be effective if these watering down proposals are in place? Now, I note that she said that the measures will be considered regularly, commencing in the week beginning 28th of June. But can she tell us how long overall she envisages the measures will be in place? And finally, these measures at the border are her responsibility as Home Secretary, but part of their delivery and part of their enforcement will be in Scotland and will be the responsibility of the Scottish Government. So will she undertake to meaningfully engage with my colleagues in the Scottish Government on their requirements before any potential changes are made in the weeks and months ahead to these?
Home Secretary.
Well, I thank the Right Honourable Lady for her questions and her comments. There are a number of points, if I may just allude to. I completely reiterate and restate the points that I made about the measures that have been taken from the beginning of the year in terms of public health measures within the aviation sector, but also enhanced monitoring at the borders to identify symptomatic travellers from high-risk areas. That happened early and safely, and people were triaged to the health systems. I think that's really important for everybody to remember that as well, and be mindful of this, because these are public health measures. She again, and in fact, if I may say so, in answer to the Right Honourable Gentleman as well, made the point about publishing the advice through SAGE. SAGE, of course, published their advice accordingly, and that is ongoing. But very specifically, she referred to potential downgrading of these measures. These are public health measures, and this is not something for the Home Office or myself as Home Secretary to consider in isolation or independently. This is a part of a wide package in terms of public health measures, in line with the public health regulations that have been laid in Parliament and put down in terms of reducing the R value and protecting the British public. And I think it is really important, Madam Deputy Speaker, for the British public and for all members, Right Honourable and Honourable members of this House, to put this into perspective in the context that we are in a national health emergency right now. This isn't about the convenience or inconvenience of certain regulations and measures being put down and the application of them. We are here to make sure that we protect public health first and foremost. And that is why it is important whenever these measures are reconsidered in due course, and they will be aligned with other regulations when they are reviewed as well, that we look at this within the totality as to how we can protect the public and their health.
Now, I would like to get everybody in. That will require short questions and short answers. Steve Brown.
Thank you. If I'm honest, I think many people will think this is the right move at the wrong time. We keep being told to use our common sense. The idea that this was wrong when Europe was at the centre of a pandemic, and right now, it doesn't add up to me, but maybe that's just me. But we are where we are, and we can't go back, so we start from here. Now, hundreds of my constituents rely on Southampton Airport for their livelihoods. It was on its knees before COVID. So while I appreciate there's much talk today of travel corridors, can I ask my right honourable friend whether the government considered travel gates to block incoming travellers from certain countries based on the science. Basically, a more targeted risk-based approach to the screening of passengers, as happens with aviation security standards now.
So my honourable friend is absolutely right. There'll be a range of measures, and I think I should just emphasise to the House and all honourable and right honourable members. Of course, this is part of our ongoing dialogue with the industry. This isn't just for government to specify the type of actions that the sector should undertake. We have to innovate together and also look at new international aviation health screening options, opportunities, but the way in which we can work to innovate and set new standards internationally. We want to be at the forefront of that, and that is something that we want to urge our industry to do as well.
Yvette Cooper.
Sir Patrick Vallance has said that the crisis escalated in this country as a result of many, many cases coming from Spain and Italy during March. So clearly the triage system wasn't working. The Select Committee has also been told that in a 10-day period from the 13th of March to the 23rd of March, up to 10,000 passengers with coronavirus are likely to have arrived at our ports and airports. The Home Secretary has still not published the science that we were promised behind these decisions. Can I urge her now to do so and to tell us what is her estimate of the number of people in the next 3-week period who are likely to arrive in the UK with coronavirus?
Home Secretary.
Well, I thank the Right Honourable Lady for her comments. I've already been clear about the measures that were brought in. The enhanced monitoring measures at the borders, I have been clear and I've outlined them. I've even provided dates to the House and I've given examples in terms of the number of airports, the number of territories, the number of airlines and the flights that were monitored throughout that period of the 22nd of January to the 12th of March. In terms of publishing the advice that I think the Honourable Lady is referring specifically to from the Home Office, I will absolutely ensure that the Select Committee receives that. And in terms of the number of incoming passengers, Madam Deputy Speaker, it is well known and documented through air passenger data, and that does not include ports, ports are separate, that the number of passengers travelling and arriving to the United Kingdom has been at an all-time low and have completely fallen off. That is something obviously we can't predict for the next 3 weeks, but obviously working with the Department of Transport in particular, we will collect that information and we will make that public.
So it's
Dr. Ben Spencer.
Thank you, Madam Deputy Speaker. The introduction of a 14-day quarantine is a very blunt tool, with many downsides and consequences, and it effectively grounds the aviation industry. Would my right honourable friend agree with me that rather than using this blunt tool, we should move as quickly as possible to a precise and targeted approach based on science and international safety standards that will protect passengers, the public, but also staff working in the airlines, the airports and on public transport, and in doing so enable our planes to fly again, saving livelihoods and businesses while keeping the public safe?
Well, my honourable friend makes very, very important points, and actually I would like to pay tribute to the aviation sector and the industry. They are dynamic, they are innovative, and when we look at the work that they have done over decades when it comes to keeping the public safe, when it comes to aviation travel, they have been world leading. That is exactly what we want to do in terms of the work that we undertake with them. Of course, this is an international crisis. No one person, no one organisation has a bespoke way of working throughout this crisis for the aviation sector. My final point, Madam Deputy Speaker, on this, is, of course, planes are still flying and goods are coming into the United Kingdom. I've made the point about exports goods. This is still very important for the aviation sector, for the freight sector in particular. And of course, that's very important to the health of our economy, but also the way in which we can continue to innovate. And
Christine Jardine.
Thank you very much, Madam Deputy Speaker. The Home Secretary has made much of the scientific advice that earlier in the pandemic it was clear that such measures would have made little difference. Would the Secretary of State acknowledge that as we have an acknowledged death toll approaching 50,000 people, that perhaps that little difference might have been significant to a lot of people in this country at that time? Does she now regret not making that little difference? And could she please answer my right honourable friend's question when he asked if that advice and the advice she refers to today both came from SAGE?
The Honourable Lady will be very well aware that not just working with SAGE, but representatives of SAGE in government departments across government, that is the scientific advice that we as Minister are guided by. And that is important to consider this in terms of the entire period from January to March and the enhanced measures that were taken at the border. And I think, Madam Deputy Speaker, it is important to recall and be very mindful of the enhanced public health protection measures that were undertaken. And had those measures not been put in place, the severity of what could have followed could have been even more damaging than we've seen over recent months.
Faye Jones.
Thank you, Madam Deputy Speaker. I welcome the introduction of a self-isolation period for those arriving in the UK. Like this government, I want to do all I can to protect rural Mid Wales from a second spike in the virus. But what discussions has my right honourable friend had with the Welsh Government and with rural police forces to ensure that this can be enforced in a four nations approach?
Good question.
My friend is absolutely right, and I pay tribute to the devolved administrations. And I know one of the questions, in fact, the Right Honourable Gentleman asked me about the time period as to when this was announced and now these measures coming into place. Much of this has been complicated because of the different approach in terms of powers that are devolved around enforcement in particular. So devolved administrations will, of course, be laying their own regulations around enforcement, but we have had constant contact and discussion across the four nations with the devolved administrations from the get-go, from the outset, and of course that will continue.
Daniel Zeigner.
This isn't just about tourism and business, important though they are, it's also about people. And my constituent, Professor Matthew Gaunt's 8-year-old son Dylan lives in Germany, and he and his ex-wife have joint custody. And in former times, Professor Gaunt used to visit fortnightly to stay with Dylan for 4 days. Now, the pandemic has torn families apart across the nation, but it's an international problem too. Yeah. So can the Home Secretary ensure that such difficult cases are prioritised?
Home Secretary.
I say to my honourable friend, this is such a difficult time for everybody across the world. And of course, we've all been split apart from family, friends and loved ones. And of course, we do want to ensure that we can prioritise key cases and look at, as we move forward with changes to regulations as well, and as we keep this under review, how we can do our utmost to unite friends, family and loved ones again.
Teresa Villas.
Can I welcome the huge amount of work I know she's doing on air bridges? And can I urge her suspend the implementation of this blanket quarantine requirement to give just a few more weeks to get those safe air corridors in place so we can save jobs in aviation and let families go on their summer breaks in the sun?
Home Secretary.
I thank my right honourable friend for her question. And there are some important points here in terms of how collectively we can work with the travel sector, not just aviation, but across every single carrier, whether it's coaches, trains, ferries as well. They're all part of the health and well-being of the travel sector and the travel economy. And of course, we will work with everybody on this. The fact of the matter is these are complicated. You've heard me say in my statement, we would require bilateral agreements with countries as well, which is exactly what the FCO are working on. And this is why this is a cross-government effort to ensure that we can get our country moving again, but also do the right thing in terms of keeping the public safe.
Lloyd Russell-Moyle.
At the start of this crisis, I had border people writing to me saying they had no PPE. I had constituents writing to me saying that they'd come back from northern Italy and Spain without being stopped at all at the border. It was a completely bungled response at the beginning. And now the horse has bolted, and of course our recovery is one of the worst in Europe, and our death rates are the second worst in the world. The government's now embarrassed and trying to close that stable. But I'm afraid it's too late. So to build any sort of trust, will the Secretary of State publish the advice that she has on this matter before she destroys our hospitality sector?
Secretary.
I'd say to the honourable gentleman that it is not my intention to destroy any sectors of our country or our economy, and I think that is a gross distortion of the comments and remarks that I've made. And my second point is I refer the honourable gentleman to the comments that I've already made around the scientific advice.
Dr. Liam Fox.
Thank you, Madam Deputy Speaker. I'm afraid I simply cannot get my head around the public health mental gymnastics of this policy. If such a barrier was required, why was it not introduced earlier in the outbreak? And if it is a contingency measure against a so-called second wave, why apply it to countries with a lower infection rate than we already have? And surely the answer lies in the government's test and tracing system rather than unnecessary economic isolation. And I know my right honourable friend's not answerable for the public health elements, so she can tell us, please, from a Home Office perspective, in the event of air bridges being established, how will it be possible to identify transit and, more importantly, stopover passengers who may be able to come through the bridge from higher risk areas to the UK?
Well, I thank my right honourable friend for the point that is made around transit passengers, but also future travel corridors. I'm sure we'll all agree on a term to use in the future. The fact of the matter is, from a Home Office perspective, we have created the contact locator form, and it is that data which will be instrumental in basically giving people that safe passage, the clearance to go through and transit onto other locations. But the fact of the matter is, Madam Deputy Speaker, that piece of work has been done. We should be able to, and this again looks to the future, working with the aviation sector, we should look to how we can adapt that so that in due course that locator form can contain so much more other information, including COVID test data or even electronic travel authorisation, that can help to really bolster the industry in the sector. As I've said, get people moving, get planes flying, get people travelling again internationally, but also give public confidence about the health protection that they're looking for.
Let's several Roberts.
At a time when most European countries are in much improved conditions than that of the UK, the concern for communities in constituencies like mine is transition by travellers within and between the nations of the UK. Now, I've spoken to the police, to representatives of the tourism industry in North Wales and local community leaders. We all want our attractions and accommodation to open as soon as possible. We therefore need to be able to provide every assurance to vulnerable residents and their families who are anxious about the risks implicit in thousands, and I emphasise, thousands of people arriving in their communities on the day after internal holiday travel restrictions are lifted in the UK. Will she come back to the House to explain what steps she's taken to ensure that holidays at home are safe for everyone?
Order. If we're to get everybody in, we do need to have very short questions and short answers. Just the question, please, will be the best way of us getting through this. Home Secretary.
Thank you, Madam Deputy Speaker. First of all, let me pay tribute to the police across the country for the way in which they have been following the approach when it comes to enforcement, but also encouraging people on social distancing. And I'm very well aware, not just across the four nations, but in particular in Wales, of great work that has taken place. I'd be more than happy, working with my colleagues across government, to come back when it comes to the domestic tourism, when it comes to vulnerability and people that are shielded, to give the assurances around public health measures and the protections that are required.
Peter Gibson.
More than 90% of countries have deployed a form of quarantine so far. Does my right honourable friend believe that the measures she has outlined today are being taken by the rest of the world are consistent, and are they vital to keeping our citizens safe?
Well, I thank my honourable friend for the point and his question. I think actually there is a reflection here in terms of the fact that other countries, of course, have introduced measures at the border, whether it's self-isolation, and much of this is self-isolation as well, on the basis of protecting their domestic population from imported spreading of the virus. It is right that we're doing this now. The science has been consistent on this, and that is absolutely in the right interest when it comes to protecting public health.
Jim Shannon.
Thank you, Madam Deputy Speaker. Northern Ireland is the only part of the United Kingdom with a land border, and therefore on the front line, literally. Can the Minister outline discussions and talks with the Northern Ireland Assembly that she referred to, how she believes that she can marry the health measures at our ports and airports, along with those in neighbouring Republic of Ireland, to ensure the viability of our ports and our airports for trade and tourism, but also for ensuring safety and wisdom?
Well, I thank my honourable friend for his question, and he's absolutely right. Of course, when it comes to trade, keeping passenger flows going, we have been working with my right honourable friend, the Secretary of State for Northern Ireland, who will be very aware of some of the discussions that have been taking place. But of course, as ever, we undertake these measures for the right reasons, to collectively stop the spread of the virus and to protect public health. And I'll be very happy to talk to him over future days as well, in the run-up to the 8th of June, in terms of the work that we're actually taking in Northern Ireland.
Sir Graham Briggs.
Thank you, Madam Deputy Speaker. Hundreds of thousands of jobs will be lost if the airlines are unable to fly their crucial peak summer schedules. But the airlines are making those decisions now. Will my right honourable friend undertake to make sure that we have clear criteria for air corridors and the first list of safe countries well before the 3-week review on the 29th of June?
Well, if I can assure my right honourable friend, and I'm very familiar with his own regional airport as well, and the operators of that airport, that is something that my right honourable friend, the Transport Secretary, will be leading on. And of course, I will work with him and all colleagues across government as well to ensure that we start really pursuing those plans and proposals. So of course we can get aviation up and running again, safeguard jobs, safeguard the economy, but also, as I said at the same time, look at the methods in which we can protect public health.
Chris Bryant.
The horse has bolted. Yeah. I don't understand why she doesn't get this. She won't be able to screen people at the ports. She can't track them when they leave the airports. She can't enforce the quarantine when people get to their homes. And she can't even ensure that these people who might be COVID positive aren't using public transport to get from the ports to their homes. So she's not going to be protecting anybody. Can she name a single country in Europe which has a higher infection rate than the UK?
Home Secretary.
Well, I refer the Honourable Gentleman to my statement and the reason as to why these measures are coming in right now. I recognise from the tone of his question that he fundamentally disagrees with the government's position and the approach that the government has taken collectively. But the fact of the matter is, when it comes to other countries, we will work bilaterally in terms of travel corridors and how we can move the sector forward to bring in the right kind of public health measures that safeguard countries, travellers and passengers. That is the right thing to do. And as I've already explained to the House, Madam Deputy Speaker, the science has been consistent on this, and these measures are here to protect public health.
Henry Smith.
Thank you, Madam Deputy Speaker. What advice did the Home Secretary receive from the Scientific Advisory Group on emergencies with regard to introducing these quarantine measures? And will she look to have a more regular review of them, weekly, I would suggest, rather than 3-weekly?
Well, Madam Deputy Speaker, as I explained earlier on in my statement, in terms of the advice that has been provided consistently, both to the Home Office and to other government departments, in terms of the review, I've outlined already the 3-week review period, but that review will be aligned with the other health reviews that are taking place, based on protecting the public. And of course, these are public health measures, and it's right that we look at all public health measures and regulations in the round to protect the British public.
Kang-Min Hendra.
Thank you, Madam Deputy Speaker. Before I ask my question, can I put on record that my wife does actually work as a contractor for an international travel company? Can my right honourable friend confirm that these health measures will be time limited and remain proportional to the threat facing our country, and will be altered when we can be sure it won't jeopardise the health of UK citizens?
Home Secretary.
Well, my honourable friend is absolutely right. I have said today already that these measures will be reviewed, and they, of course, will also be reviewed and aligned with the other health measures that have been brought in. And I emphasise again, Madam Deputy Speaker, it's important to look at this within the totality, in the round, alongside the actual desire of our country and government to get the R value down so that we can unlock and reopen society in so many other ways.
John Speller.
Thank you, Madam Deputy Speaker. And just now we had a junior Transport Minister subbing for the Chancellor, wringing our hands about the aviation industry. And the Home Secretary has just thrown her, the industry and its workers under the bus. And at the same time has put up a massive "Britain is closed" sign. So at the very least, will she demand from the Chancellor of the Exchequer that he extends the furlough scheme to try and avert hundreds of thousands of workers being thrown on the dole in the next few weeks?
Well, first of all, Madam Deputy Speaker, I do find the right honourable gentleman's tone somewhat objectionable. I've been incredibly supportive of the aviation industry, and I can hear sarcastic cries of tough. I think it's important to reflect the way in which the aviation industry is dynamic, it's innovative, it's huge to our economy, and I'm not shutting it down. On the contrary, I'm working with my right honourable friend, the Transport Secretary, the Business Secretary, and all colleagues across government. These are cross-government measures which I will restate to all members of this House when it comes to protecting the public health of our nation. And of course, I hear his comment with regards to furlough scheme, protecting jobs. Of course, we all want to protect jobs. This has been a tremendously difficult period. Economically, we will have major economic issues to confront as we come out of this dreadful, dreadful situation. We're not on our own. The international economy is in exactly the same space, and it is right that we work collectively rather than in an aggressive way and in a hostile way to find the right solutions for the people of this country in terms of health protection, but also their long-term jobs and their livelihoods.
Harriet Baldwin.
Thank you, Madam Deputy Speaker. After 9/11, the aviation industry found a way almost instantly to find box cutters and get them off aeroplanes. After the shoe bomber, the aviation industry found a way almost right away to detect the smallest quantity of liquid in people's luggage. So if tomorrow the aviation industry and the inventive people around the world are able to find a way to swab and take temperatures and get an almost instant result back before and after every flight, will she drop these regulations?
Well, first of all, Madam Deputy Speaker, it is not for me personally to drop these regulations. These regulations are being laid across in the House in conjunction with other government departments. But it is, and I do want to emphasise this, and I've said this on the 22nd of May, that this is just one component. We're speaking about track, trace and isolate, potential fast testing for passengers. There are many other aspects to how we can make aviation and travel safe going forward to protect passengers and their health. That is exactly what we need to do, working with the aviation sector and the travel sector and other carriers. And of course, it's for them to innovate, and we will support them and work with them to make sure that we can look at all measures that we can bring forward for the sector to keep passengers safe, but at the same time to protect the British public.
23 and 24 withdrawn, so we go to Lillian Greenwood.
Thank you, Madam Deputy Speaker. Scientific research into this virus is thankfully an international effort. So can she explain the evidence that she's seen that underpins her decision to introduce a blanket 14-day quarantine now, at precisely the time that other countries are beginning to ease restrictions that they introduced months ago? Why is the UK government's approach so at odds with our neighbours?
Well, first of all, I refer the Honourable Lady to my statement in terms of why these measures are coming in right now. And my second point is these are cross-government measures. These have not been taken in isolation, i.e. just one department. We are working across government, led by the Department of Health, working with my right honourable friend, the Transport Secretary, working with the Business Secretary, working with the Chancellor of the Exchequer across government. These measures have been put in place collectively, and they will stay in place until the public health situation in this country changes. And this government, Madam Deputy Speaker, finally, is absolutely committed to protecting the public health of our nation. That is the right priority. I know she clearly disagrees with that and shakes her head, but at the same time, we will continue to work with the industry to look at new measures going forward.
Sally Ann Hart.
Thank you, Madam Deputy Speaker. Looking at our soft borders, which are our beaches, can my right honourable friend reassure the residents of Hastings and Rye that for the migrants illegally crossing the Channel in small boats who are not returned to France are being given health checks for their own safety and well-being and for the safety and well-being of my constituents?
Well, my honourable friend is absolutely aware of the work that we are doing on this right now, including returns to France directly, so she can have that assurance. And when it comes to the self-isolation measures, they equally apply to people that come to our country illegally.
27 withdrawn, so we go to James Sunderland.
Madam Deputy Speaker, many of my constituents depend upon the aviation sector for their livelihoods. Bracknell also has the offices of over 150 global companies. Could the Home Secretary please assure me that the support for my constituency and beyond will be given through a pragmatic application of the policy, and also that the policy will not just be reviewed but lifted at the first opportunity?
Well, I thank my honourable friend for his question. He's absolutely right and makes a very powerful case on behalf of his constituents and their livelihoods for the sector that they are employed in. And it is absolutely right, Madam Deputy Speaker, that we as a government continue to work to give that support. I'm committed to doing that, as are all Secretary of State across government.
29 withdrawn, so we go to Natalie Elphick.
Thank you, Madam Deputy Speaker.
When reviewing safe journeys in the coming weeks, will my right honourable friend consider that ferries have a COVID-secure option that aeroplanes simply don't have? And can I ask her to keep front of mind our beautiful White Cliffs country and the Dover-Calais ferry for not just a safe and enjoyable holiday break, but also to save our local jobs and livelihoods?
True. Well, my honourable friend is absolutely right when it comes to representing her constituency, her constituents, but also the local economy too. And that applies across the country where we have ports. She's absolutely right also to highlight the need to have safe travel, but travel obviously that can be applied consistently across travel carriers as well. And that is something obviously that my honourable friend, the Transport Secretary, and I will be putting forward and raising, discussing tomorrow in our roundtable.
David Linden.
Many thanks, Madam Deputy Speaker. What discussions has she had with the Chancellor of the Exchequer about how to mitigate the impact of these measures on the aviation industry, and how will they affect efforts to support it to play a sustainable role in rebuilding the economy at local, national and regional level?
Yes, Madam Deputy Speaker, discussions have taken place through the usual channels across government, and in fact there have been up until recently a series of committees involving the Treasury and every single government department that is involved in this public measure and in this public health measures to discuss the impacts, economic but also health impacts, and the way in which these measures would be brought together and enforced and applied across the 4 nations.
Tom Hunt.
Thank you, Madam Deputy Speaker. A couple of months ago, my constituents were overwhelmingly of the view that there should have been an international quarantine introduced then. Overwhelmingly. I believe right now they're still finely balanced, but just of a view. But one is necessary. So I will be supporting the government on this. But at the same time, I am getting more and more emails from constituents who have loved ones in other countries. So please commit to a flexible approach, and at the nearest opportunity, please do relax it.
Well, I think, Madam Deputy Speaker, not only, I hear everybody's comments, and I am very conscious of this, as is my right honourable friend, the Transport Secretary, as is the whole of government. The fact of the matter is we all want to be reunited with friends and loved ones as soon as possible. We have to do this in a safe and in a responsible way, and that is what this government is committed to achieving.
Wendy Chamberlain.
Thank you, Madam Deputy Speaker. Reports suggest that SAGE was not asked for updated advice before this announcement was made. So I asked the Secretary of State, what is the estimate of the likely numbers in the outlined exemption categories to her policy, and what is the scientific assessment of potential transmission from these groups?
Well, I referred the lady to my statement earlier. We have based this on scientific advice across government, and that is scientific advice not just within the Home Office but across other government departments as well. So, as I've said in my statement, that information in due course will be provided in the normal way, but it is important to reflect and recognise as to why these measures are coming in place. That is to protect the health and well-being of the British public.
Sir Geoffrey Clifton-Brown.
On behalf of a significant number of constituents whose jobs are affected in the travel, tourism, leisure business, could I ask my right honourable friend if she would seriously consider and review as urgently as possible establishing air bridges, particularly with countries where the rate of infection is lower than our own?
Madam Deputy Speaker, I think I've answered this question previously, but absolutely right. It is our determination to ensure that we work with the travel industry, with all carriers, to find the safe way in which people can travel, and of course that is our priority.
Emily Lilbert.
Thank you very much, Madam Deputy Speaker. By mid-March, over 80 countries had imposed quarantine measures and travel restrictions. By May, it was reported that over 95,000 people had flown into the UK through lockdown. Does she feel her delayed action has contributed more or less to the UK having the second highest coronavirus death rate in the world?
Madam Deputy Speaker, I could not have been clearer in my statement, and also when I outlined the enhanced monitoring process that took place at the border between the 22nd of January and the 12th of March. And it is right that those measures were undertaken, and I've said in my statement as to why these measures are being brought in now.
Andrew Griffith.
Speaker, and I welcome my right honourable friend's commitment to show that Britain is open for business. We have a designated testing minister. Can I tell my constituents who are devastated in Arundel and South Downs who will be the accountable minister for putting in place agreements with safe countries?
Home Secretary.
Well, my honourable friend is absolutely right to ask this question because these are cross-government measures. So in terms of bilateral agreements, of course, that will be with the Foreign Office on the test and trace and isolate approach. That is the Health Department. And when it comes to sector-specific issues, they will be department by department. But when it comes to travel and aviation, this will be obviously the Secretary of State for Transport and myself, and I'll continue to work collaboratively across with all government departments.
Hendrie.
Thank you, Madam Deputy Speaker. Regardless of the merits of otherwise of this measure, it will disproportionately hit tourist economies, especially in rural areas such as the one I represent. The Secretary of State said earlier that she understood the impact. Can I ask what specific conversations she's had with the Chancellor about extending furlough and issuing grants to help the sector survive?
Well, I have discussions with the Chancellor on a regular basis, and of course that applies to all aspects of the economy, not just the furlough scheme. And I'd be very happy, having heard the honourable gentleman, to take away specific points that he has, and I will raise them with the Chancellor.
Sir Desmond Swain.
To limit a second wave of economic damage, will she bring forward the review of this policy by 10 days?
Home Secretary.
I have said, Madam Deputy Speaker, the review of this policy has been outlined in the statement, and that is the approach that we are taking.
Munira Wilson.
Thank you, Madam Deputy Speaker. The Home Secretary has acknowledged in her statement that introducing public health measures at our borders once we were at peak was too late. So will she finally concede that we should have introduced this well before community transmission was widespread? And will she answer many honourable members' questions with a direct yes or no? Was SAGE consulted on and did it recommend the measures that she is announcing today?
Home Secretary.
I have outlined my position in the statement earlier on, and I think it's important to say, when it comes to measures at the borders, I've outlined the dates in which enhanced measures were taken, but also I have not referred to the millions of British nationals who were stranded abroad, and had we have closed our borders in the way in which the Honourable Lady is referring to, they would not have been able to come back to the UK.
Yes, they would. Yes, they would. You don't understand. You don't understand the process.
Barracking, not a good look. We need to get through this quickly. Diana Davidson.
Thank you, Madam Deputy Speaker. Everyone in this House and my right honourable friend will know the very stark dangers that a second wave could present to our economy, but also to our society. So does my right honourable friend agree with me that by introducing these new health measures at the border, we will be limiting the possibility of a second wave and keeping our citizens safe?
Home Secretary.
Madam Deputy Speaker, my honourable friend is absolutely right, and she has just emphasised the need to protect the British public from a second wave. And that is the purpose of all the measures, the public health measures the government has been bringing forward. Because at the end of the day, we do not want to lose the gains that we have made in recent weeks. We are past the peak of this virus, and that is something that we still need to continue to double down on and make great progress on.
Ms Elmore.
Thank you, Madam Deputy Speaker. I have constituents who are due to be travelling in the next 2 to 3 weeks who've been emailing me asking specifically about using public transport or whether family can collect them, all of them, from Heathrow Airport. The Home Secretary doesn't seem to have answered the question despite being asked what will the guidance be, because my constituents need to know now, not in several days or weeks' time.
Madam Speaker, all guidance will be published in advance of June the 8th, and of course that comes from, the guidance will come from other government departments specific to airports, transport, and obviously public health measures as well, so the guidance will be made available.
Pausing.
Thank you, Madam Deputy Speaker. Many businesses, especially those engaged in manufacturing, have a need to get a key worker on site quickly. That could be a UK employee returning from holiday, not able to work from home, or an overseas specialist such as a plant maintenance engineer to keep a plant going. Will there be an exemption to support British business in circumstances such as these?
So, my friend is absolutely right to ask the question. We will be publishing the list of exemptions, and within that there will be critical infrastructure workers and specific categories led by the key departments that are sponsoring those exemptions, and of course there will be key sectors that are also included in that exemption list.
Afsal Khan.
Thank you, Madam Speaker. The government's quarantine policy is not universal, and there is a relatively long list of occupations exempted from the self-isolation requirement. Can the Home Secretary confirm that those exempted from quarantine will still be tested for coronavirus upon arrival at the UK border? And if they test positive for the virus, what will they be required to do?
Secretary.
Well, I think in answer to the Honourable Gentleman's question, many of those are deemed as key workers. They have access to testing, they are being encouraged to test. And of course, as anyone that is symptomatic or test positive, they must follow the guidance that has been put in place, which is to either, if they're sick, to obviously self-isolate, and if they're symptomatic, they must self-isolate, but also get advice, medical advice, and get treatment.
Smith.
Thank you, Madam Deputy Speaker. With small businesses particularly being asked to step up and reboot our economy, they need certainty. And I've been contacted by a business in my constituency concerned that, notwithstanding the general advice for non-essential travel, some employees are still determined to have their holidays. Can you give could my right honourable friend give clarity over the status of returning holidaymakers in terms of whether the business should swallow that cost or whether they should be forced to take it out of annual leave?
Well, if I may, Madam Deputy Speaker, I cannot give specific advice for businesses and employees, but what I would say is that it's important to follow the Foreign Office travel advice and guidance right now. And the FCO has been very clear about not travelling, obviously because of coronavirus, but that all non-essential travel should not take place.
Christian Matheson.
Madam Deputy Speaker, this will affect the aviation sector and also hospitality and travel and tourism, but upstream it will also affect our aerospace manufacturing sector. Can the Home Secretary tell the House what specific economic impact assessment was made on the effect of the aerospace sector with this policy?
My friend is right to raise the economics of this. This has been discussed in various economic committees at government, and of course I have been speaking to the Chancellor, working across government with my colleagues, and it's important to reflect we've had those discussions, and impact assessments have been undertaken through government departments in the right kind of way.
Robert Goodwill.
Thank you. 300 people are working safely today constructing the £4 billion Anglo-American Sirius mine in North Yorkshire. The driving of the 1 mile deep shaft and the 23 mile long tunnel to T-Spot does require a small number of specialist engineers from places like Germany and Austria living in specialist accommodation away from their families. Could you give me an assurance that workers like this will be part of the exemption from the quarantine?
Secretary.
Mr. Speaker, I understand the case that the Honourable Gentleman is making, and of course we do have an extensive exemption list for specialist skills and individuals that are required for key projects and key work, but I will absolutely take the full details away from him and raise that with the Department of Business.
Vera Hobhouse.
Thank you. The exclusion of medical and care professionals from the travel restrictions highlights how essential they are to the UK. It also highlights how problematic the government's new immigration rules will be. Will she commit to a much fairer and safer immigration policy than that are currently on the table?
Home Secretary.
I'm sorry, Madam Speaker, I missed the Honourable Lady's last sentence. I didn't quite hear her, but I'll happily follow up. I think that was in relation to the immigration system, the points-based system, but I will happily follow up with her again.
Paul Maynard.
The Right Honourable Lady just made reference to the exempt professions that are going to be covered by this measure. Given the credibility of it is hanging by a very thin thread right now, can she reassure me that members of Parliament will not be on that list of exempt professions?
Home Secretary.
This is an issue that has been discussed extensively, so I think when the Honourable Gentleman sees the exemption list, he'll be very clear as to who qualifies and who doesn't.
Stephen Doughty.
Madam Deputy Speaker, like care homes, I fear that the failure to act when it could have made a difference will be one of the great tragedies of this crisis when the inevitable inquiries follow. And the Home Secretary keeps saying that she was following the science and the science was consistent. But the Chief Scientific Advisor to the government said to the Health Committee on the 5th of May that the UK got many, many different imports of the virus that seeded right the way across the country as early as March. Now, if that's the case, why did the government let in 23.7 million passengers, many of them British, returning from abroad from hotspots between the 1st of January and the 31st of March? Why did they not put measures in place earlier? And will she now not only publish the advice, but tell us, is it true that Sage first discussed this on the 3rd of February? Was she involved in that discussion? Was the Transport Secretary? And who overruled who about taking action?
Secretary.
Thank you, Madam Deputy Speaker. Sage papers are being published and they are in the public domain, so he can look out for those and see what information has been put in place. And Madam Deputy Speaker, I do come back to the point that I made earlier on about the enhanced monitoring process that were taken at the border, all of which I highlighted in my opening remarks.
Christian Wakeford.
Thank you, Madam Deputy Speaker. Would my right honourable friend advise whether or not she believes we got the science right earlier on,
And if so, are we getting the science right now in terms of quarantine and putting restrictions in place in terms of travellers?
Home Secretary.
What I'd say to my honourable friend is that the government has been guided by the science from the outset of this, and this isn't just for one department, this is across government, and collectively we have been guided by that scientific advice, and that has been consistent when it comes to public health measures at the border, which is why these measures are being introduced now.
Thank you. Oh, point of order, Karen Bradley.
Thank you very much, Madam Deputy Speaker. On a point of order, can I welcome the Prime Minister's announcement earlier that he intends to extend the proxy voting